Bismillahirrahmanirrahim. Welcome back to the pharmacology. Now we are actually starting the pharmacology. First, we cover the general pharmacology, in which we have to cover two things. One is the pharmacokinetics. Second thing is the pharmacodynamics. So start off because this whole concept of pharmacokinetics and pharmacodynamics, we are in which we do not actually interest in the drug. Actually, some you can say physiological, like this general pharmacology is like your physiology. So we have to cover up this because this whole idea applied in our systemic pharmacology where we actually study the drug. So pharmacokinetics, although pharmacodynamics, I used this term in last lecture. So just recall your mind. As I mentioned, when we take a drug, so this drug after the by entering the mouth, esophagus, stomach, reach the intestine, where you can see on the side the blood vessel. So let's see, here is a drug. So when you look at this, this is moving here and it absorbs to the blood vessel. So this is our first step for the drug movement. If you give this drug intravenously, so your drug has there is no need for the absorption, so it's directly coming into the your blood vessel. So this route. So we actually use two words. One is the extravascular, other is the intravascular. Intravascular means inside the blood vessel. Extravascular outside the blood vessel means you are taking orally, sublingually, or rectally. So these all pathway are all these routes of taking drug are considered as extravascular, intravascular, and extravascular. Okay, so absorption. Then the next step is the distribution. So this drug has to distribute into different tissues. So let's say this drug is going to distribute into different tissues. For example, it reaches this is going to the your target tissue and going to the your other tissue and liver and the kidney. So there is importance for each target. If your drug reaches your actual target where they produce the actual effect, we call them the therapeutic effect. If it goes to other tissue, they cause the adverse effect or you consider the side effect. While in the liver, it metabolizes. So, and in the kidney, finally excreted because after the metabolism, so drug is ready for the excretion. Okay. So we have two parts. One is the pharmacokinetics, other is the pharmacodynamics. So pharma, simple word. Pharma mean drug and the kinetics mean movement. Your drug movement. So it is actually we study like this. What body does to the drug? Mean your body is the subject. Your body has to absorb the drug. Your body has to distribute the drug. Your body has to metabolize the drug. Your body has to excrete the drug. ADME: absorption, distribution, metabolism, excretion. The other part is the pharmacodynamics. So pharma means drug, dynamics means power. So what is the power of your drug? So mean what drug can do to your body. It can cause therapeutic effect. It can cause adverse effect. Mean we are focusing on the drug in the pharmacodynamic. While in the pharmacokinetic, we are focusing the body situation for the absorption, the distribution, metabolism, excretion. So ADMA. So we start from the pharmacokinetics, then go for the pharmacodynamic. In the intro, I mentioned we need our basic anatomy, physiology, biochemistry, whatever we have studied. It is there is importance. So, my explanation is such way I do not confuse the student or insulting the student. You have not good with your basic, so you don't listen this session. So I recall your concept, then I go for the your next level, that is our this situation clinical or pharmacology, pathology, whatever we are studying. Okay, so for the absorption, just recall your the anatomy at the your GAT level. So important thing is your blood supply. So mean if you recall your blood supply for the GAT, our blood supply is the, go into the first they go into the portal circulation, then it go into the systemic circulation. So in absorption, actually our concern is we have to take drug from intestine and put this drug into the your systemic circulation. So this is concern of absorption. We are going to the absorption. So just recall your mind. So blood from stomach, blood from your intestine goes into the portal circulation, and this blood is going into the liver. After the crossing the liver, then it goes into the systemic circulation. So this is our target in the absorption. So let's see. You have taken your drug. As you take your drug, it moves from mouth to esophagus to stomach and finally reach to this lumen of your GAT tract or the intestine. After this, this drug has to absorb from intestine into these portal with the capillaries. So this capillary network of your portal system. So and the hepatic portal vein is going into the your liver. So this is your complete hepatic portal system. So here our first step is occurred. So that is your absorption. So drug has moved from your lumen of GI tract enter into the portal. After this, so this is our first concern, absorption. Okay. So then the next concern, this drug goes into liver where they metabolize. Mean they some of your drug is destroyed by the liver. So metabolize the so this is our second step that is here. So after this drug move into the liver. So we use the one our drug first pass by the liver. So we use where they metabolize. So you use one first pass metabolism. First mean before they entering into a systemic circulation, some of drug is destroyed by the liver because they are first passing by the liver where they metabolize. We use one first pass metabolism. So if you look at it, then the third strategy is there. So we use the word the biological available drug. We use bioavailability. Mean in simple. For example, you have given 100 mg and your 20 mg is destroyed by the liver. 80 mg is reaching into the your systemic circulation. So we can say 80% is the bioavailability, 20% is destroyed by the your liver. So absorption is also important. So your bioavailability, which is really important in this concern of pharmacokinetics. So bioavailability is 80%. Why? Because your 20% is destroyed by the liver or it's not properly absorbed. So in this concern, we absorption, although we have studied in the physiology, but these two terms, first pass metabolism, bioavailability, amount of drug reaching in the systemic circulation, and first pass metabolism, the drug destroyed by the liver. So this is our first concern. So we need to look at the actually why we are interested. So some drug bypass the first pass metabolism, some drug undergo the first pass metabolism. So let's see if you have given the drug intravenously, does this drug first pass metabolize? Of course not. Why? It's not going into portal circulation. This is drug is directly entering into our vein system. So that's why there is no need for the absorption. There is no need for the first pass metabolism. So your bioavailability depend upon these two things. Absorption, first one. If these two things are bypassed, means your bioavailability will be 100%. So only intravenous route where your bioavailability is the 100%. If you look at the other thing, for example, orally, if you when you look at the orally, they have to absorb, they have to first pass metabolism. Means their bioavailability will be less than 100% because it may not 100% absorb, it may not reach the systemic circulation 100%. Yeah, because some drug is discharged by the liver. So you can see here. So if you look at the amount of drug here and here, so because some drug is discharged by the liver. Okay. If you look at the other route, for example, sublingual. Have you seen, for example, a patient come with angina mean chest pain like or myocardial infarction patient, heart attack which you call it normally. So what do? You give the nitroglycerin type drug which you put under the tongue. So that is sublingual route. So in this step, our drug has to absorb, but they have not have to first pass metabolism. So they are bypassing the first pass because this is here is systemic circulation. So this drug directly absorbed by the capillary network which is under the tongue. So in this case, our although our bioavailability is little higher, but one step is occurring, that is absorption. So mean our bioavailability will be less than 100%. So this is major concern. Other is the rectal. You give the drug rectal. Rectally, what will happen? Your drug, what should be the bioavailability? Our question will be again and again the bioavailability. You use the rectal route. Recall your rectal anatomy. You have two circulation systems. I put it here. So if you look at the rectal, so we have two part of rectal. One is the upper part that which goes to the upper part here, superior rectal, while on this lower part we have middle and the inferior rectal. So if you recall your anatomy, we have studied. So this superior rectal goes to the portal, inferior mesenteric, which goes into the portal circulation. While these two, middle and the inferior, they enter directly into the systemic circulation. So we can't. In this case, we use one the partially first pass metabolism. Why? Because our the drug which is absorbed in this part, they have to go into the portal circulation, while they absorbed by the your middle and inferior, they directly go into systemic circulation. So we use one partially first pass metabolism. So these are terms. I cover these two terms, first pass and bioavailability, then go for the absorption because it's very straightforward like your physiology. Sorry. Okay. Okay, it's very straightforward, no confusion. Now, move to the first pass metabolism. First pass metabolism by the liver. So if your liver is not properly functioning, there is hepatic problem, your bioavailability higher. So in this case, it's not a good because we are in our mind. For example, we know the bioavailability of some drug is 80%. So if the liver is not properly functioning, bioavailability will be increased, maybe reach into 90%. So this concept should be very clear. Now look at the situation other. For example, you have so this is very same thing, same idea. GAT, your drug enter into liver, then it goes into your systemic circulation. Then the amount of drug reaches to the circulation is decreased. So it's very straightforward. So for this B is actually showing you the intravenous where they have no absorption, no first pass metabolism. So sublingual route bypass of first pass metabolism, we have explained this because they are directly entered into systemic circulation. So while if you look at the rectal route, they partially bypass because superior rectal goes into your portal circulation, while if you look at the middle and the inferior rectal, so they enter into the systemic circulation. Okay, now let's look at the bioavailability. I think we have already covered. Measure of the fraction of dose that reaches the systemic circulation unchanged. How my drug actually reaching into your systemic circulation. So it is important to adjust the dose. Why it is important? For example, I will give you example. It's how for example, you know the drug A. its bioavailability is, for example, 50%. Okay, so if you want their 20 mg per liter concentration in the plasma, so how much drug you give? For example, if you have given this patient 20 mg drug, what will happen? If you given 20 mg, mean 50% will be destroyed by the first pass method. So 10 mg will reach to the your systemic circulation. So in this condition, we can adjust the dose. How can we adjust? We give 40 mg in order to gain our 20 mg. So first, bioavailability is important. If we know the bioavailability of drug, we can adjust the dose. If it's 80%, we can change with the condition. 50%, 60%. Intravenous there is important because there is always 100%. So don't confuse with the intravenous. All other routes have less than 100% depending upon their condition. How much they are first pass metabolism, how much they are absorbed. Okay. So for the IV there is 100%, while for example orally or other extravascular pathway is less than 100%. So it depends on two things. Number one is the absorption. Number two is the first pass metabolism. Very straightforward. Now let's a graph which is most of the time is tested in your this concept is actually tested in the step 1 exam. So let's see at the 0 time what's happening. Here is plasma drug concentration on this side y-axis, on the x-axis we are showing the time. So for example, you have given intravascular dose for the IV bolus. IV bolus in the hypoglycemic condition too, we give the IV bolus. Okay, so what will happen? As you give the drug, your drug directly entering into your intravenous. Mean what will happen? Your concentration reaches straight here. So like this up, and eventually by the time it's going to distribute, it's going to metabolize, it's going to excrete. So this is actually the area for your intravascular. So if you compare with the extravascular, for example, you give a drug dose with the orally. So they start from here, like this. So this is area under the curve for the orally. So and area under the curve, this is for the intravenous. So intravenous is actually used as a cylinder. Why? Because you know better, they have 100% bioavailability. So for this, how we can calculate the bioavailability? Here is the formula. So area under the curve orally versus over the dose orally divided by area under the curve intravenous over the dose intravenous. So we can change multiply by 100. So this gives a fraction, and by multiplying 100 we got the actual percentage. So or we can use like this. So by changing your mathematical calculation, so change your division with the multiplication. So dose, this will come over here and this come here. So like this. So this is very straightforward calculation for the bioavailability. So this is used for especially important for the your step 1 exam. Okay. If you look at the various drug absorption of various drug given by oral route, so liquid, syrups, elixirs, so they have fastest, while if you move for suspension, powder, capsule, tablet, coated tablet, enteric coated, they have slowest rate of absorption. So this is actually important when you use the different formulation. So there is some changing in the rate of absorption. Very straightforward. So mechanism of transport. So these are just terminology. You are ready. So for example, epithelial cell is here. So they are connected by different tight junction. So you can see it. So these are actually tight junction. Okay. So let's see. So there are different mechanism of transport. For example, here is capillaries on this side. This is your apical side, this is your basolateral. So students confused what does mean by apical and basolateral. The side which is toward the blood vessel, basolateral, blood vessel, basolateral. Apical is the opposite, that is toward the lumen of your the intestine or epithelial cell. Okay. So transcellular means in the crossing your cell across the cell. So like and the other is paracellular between the cell, and the other is your vascular. Three route actually we use transport. Transcellular like this, it is crossing your cell epithelial cell. So this is reaching into capillary. So this is transcellular. This is the passive diffusion. So other is like this, using the carrier. So this is also part of your transcellular transport. So by using the carrier, so it's a carrier mediated transport we consider as the facilitated transport. While the paracellular, so they are in between the your epithelial cell like this. Okay, so paracellular. So vesicular, where we use the endocytosis or exocytosis. So this is like this. So first the endocytosis, okay, then enter into the cell, and then exocytosis, and finally reaches the cavity. So this is two parts, endocytosis and the exocytosis occur. So this is actually used for the when this molecular size of your drug is larger. Okay, sorry. So in the physiology you also studied when in this case your membrane is going to decrease or reduce. Why? Because this part of membrane is going with the your endocytosis. So this part, while in the exocytosis your membrane is going to increase. So this is part of physiology. I'm not concerned. Okay. Now come to the actually absorption. So although this is absorption, these are mechanism are the way of transport. So what are the factors which help this transport, passive, active? So first, very important. So because my explanation is in the initially I explain the difficult part, then and then just go through the slides. So pH, just recall your mind, because if you have very good basic you can understand pH. So first factor which affects in your absorption, pH, acidic and basic, very important. So when your hydrogen concentration is high, means your pH is low, then we call them the acidic. If your hydrogen concentration is low, means your pH will be high, and this is basic. So medium. So we use two terms. One is the acidic, basic. Acidic has ability because they have high hydrogen ion concentration, so they have ability to donate hydrogen ion, donate proton, while basic has ability to receive the proton. So this is very straightforward. So now look at the pKa. pK is a term we come to later. So we are applying this into the drug. So this pH concept. Our drug come into two forms. Either they will be a weak acid, either they would be a weak base. So for both we have to look at their absorption and the elimination. Absorption and elimination. So this is actually confusing for some students. So I use simple explanation for them, my friends. So two medium, as you see, when you a very simple, I use example. For example, you are going into your class, you find two kind of people. One are naughty guy, one are the cool guy. So like this, naughty guy and the cool guy. Okay. So just apply this concept because this will help you understand. So naughty guy, cool guy. When the cool guy enter into naughty guy family, so they don't like this. They want to get rid of this. They feel me irritating. Okay, or heartbroken, you can say, and they start sweating. Just for the example. So and want to get rid of that. Why I am using this example? Because this concept is applied here. So heartbroken, you can say, mean they are ionized, or you can say, okay, heartbroken. Sweating means watery, mean hydrophilic. And get rid of mean when the opposite medium, mean because cool guy enter into the naughty guy family. opposite medium. These conditions actually, in this way, they want to eliminate or want to get rid of that. So when your drug goes into opposite medium, number one, where they ionize, number two, number three, if they are hydrophilic. So these three conditions actually help for the elimination. So if they are sitting in their own family, own medium, same medium, so and they are the lipophilic or they are the non-ionized or the neutral, you can say, then they want to absorb. So the same idea is applied here. Just look at here. Okay, so for example, weak acid. So weak acid, when they sit in the acidic medium, they are non-ionized, so they are lipophilic. So this help for the absorption of the weak acid. While if you look at the elimination, for the elimination, they would be more basic. When they go into the basic medium, they ionize, they become hydrophilic. Vice versa for weak bases, absorption medium should be basic, so non-ionized, and lipophilic. For elimination, medium should be opposite, acidic, ionized, and your hydrophilic. So only medium is changing, the concept is same. Okay, so this is very important because for the absorption, when we want to absorb, for example, acidic drug would like to absorb in the stomach. Why stomach? Because your stomach pH is low, means it's more acidic. When the weak base drug would like to absorb in your intestine because there is pH is greater than the stomach. Okay, so also surface area also helps for the absorption. So what is pK? pK is that point where your drug, mean those friends where you want to sit are also get rid of. So mean 50-50. 50% ionized, 50% unionized. So that is actually pKa. Okay. Now apply this concept for their weak acid. For example, aspirin is a good example. So here is aspirin in the acidic medium. As in the acidic medium, they are non-ionized. If they go into the basic medium, what will happen? They give the proton because they have ability to donate the hydrogen ion. So in this case, so they are non-ionized in the acidic medium, so they would like to absorb. While go into opposite, they ionize, and finally what will happen? They want to eliminate. If you apply the weak base, for example the morphine, so what will happen? For example, here is morphine. So basic to in the basic, they are non-ionized. As they go into the acidic, where they receive the hydrogen ion. So what will happen? Non-ionized in this medium in the basic, while as they go into the acidic medium, they would ionize. So ionize help the elimination. So now other term which is used, the protonated form mostly in the when you see in the MCQ. So protonated, unprotonated. So if you look at here, non-ionized form. So this is actually your protonated, means your hydrogen ion is removed. While in the acidic, this is protonated form. So while if you compare in this case, here is protonated form, mean hydrogen ion is added, while in this is unprotonated. So protonated mean, because protonated mean hydrogen is present. So it's important for the acidic. So they are absorbed, while opposite for your basic medium. So protonated form of your basic drug will eliminate. Very simple. So just think about that. It's very easy. We can use this elimination concept over the drug poison. For example, if you have acidic drug poisoning, means overdose of your acidic drug. So another thing is basic drug. For acidic, change the medium. You should alkalize the urine because it's acidic drug ionized and finally excreted. If you basic drug poisoning occur, what you have do? Urine acidify, drug will be ionized and finally excreted. For example, barbiturate or silicate, these are drugs just for example. So in this condition, we how we can alkalize the urine by giving the sodium bicarbonate. So finally, ionization excretion for the basic drug, for example, morphine or amphetamine. So we can give the NH4Cl, ammonium chloride. So in this way we can the acidify urine. So other example are acetazolamide, and aspirin overdose. So in this way we can alkalize the urine. So this is actually your carbonic anhydrase inhibitor. So for example, hydrogen bicarbonate and CO2. So in this way they alkalize the urine. Vitamin C and carnberry juice. So this is also used for the acidity. So other factor which affect your absorption are like you have studied in the physiology. For example, blood flow will be higher, more blood flow, more absorption. So if in the shock condition, your absorption will be decreased. So that's why we use the intravenous route in those conditions. Intestine has more surface area, so that's why their absorption will be higher than the stomach. So same in muscle and the fat. Why? Because their muscle has more blood supply as compared to fat. So when you, for example, intramuscular compare with the subcutaneous, so they have more blood flow, they have more absorption as compared to the fat. So slow absorption. So membrane thickness, how much your membrane is thickened. More thickness, less absorption. So for example, if in the case of fibrosis, what will happen? Your thickness of membrane is increased, so that's why you decrease the absorption. Contact time, increase or decrease. So if your contact time if the contact time increase, your absorption will increase. If the contact time is decreased, for example, in the diarrhea means is continuously your fluid is going out. So in this condition or vomiting condition, your contact time is going to decrease. That's why absorption decrease. While if compare with the constipation, where your contact time is increased, as this increase, your absorption is increased. So diarrhea decrease absorption versus constipation increase absorption. So expression of P glycogen, it's actually membrane transporter protein which actually pump drug out like this. For example, here is your membrane of your drug. So what will happen? There is gene expression of this P glycoprotein as a drug. For example, here is a drug. It want to enter into this. So this P glycoprotein will repel the drug. So mean they throw back this drug. So in this way, if the more P glycoprotein are expressed over the membrane, they will repel your drug absorption, mean they decrease the absorption. So same thing is mentioned here. Okay, very straightforward. So male absorption also decrease the absorption. Now other factor like your molecular size, the bigger the size, slower will be absorption, but the duration of action will be increased because the absorption is slower continuous for the longer time and less doses are needed. So while if the smaller size, mean your smaller size, faster absorption, but so as they faster absorb, so means they are faster going to fastly excreted. So that's why duration of action will be decreased. That's why we needed more doses in this patient. Drug solubility, if the drug move in the one is the aqueous solution, if you compare with the allyl solution, for example suspension or solid form, as they coming in the aqueous solution, they are rapidly absorbed. If they are coming in the allyl solution like suspension or the solid form, so they have slower absorption. Drug concentration, higher the dose, as you increase the doses, your concentration will be increased, your absorption will be increased. So opposite, if you are lower the doses, lower the concentration, lower will be your absorption. Biopharmaceutical factors, so these are for example tablet compression or coating or excipient. Coating, you know better the drug, your most of coated drug. So they actually affect your absorption rate. So excipient is actually the term used, for example, in the drug you have mentioned, you have seen 500 mg. If you put that drug on if you weigh this over the way, if you check the weight of actual drug, they will be 1 mg or 2 mg. But in the on the over this you have mentioned the 500 mg. Mean other that the 1.5 mg is increased more than that is excipient. So which is actually we use for. So it's important because your drug cylinder should be proper coating. If it's not properly coated, because the doctor knows they have it's properly coated, so they affect the absorption if it's not properly coated. So I think absorption is over there. So we stop it here. Inshallah, we cover the distribution.